First of all, thanks for such a huge interest here. I think we should have about 80 folks attending this session.
Cool.
I believe that also includes folks who are looking at us virtually. My name is Sasha, and I work at the interoperability implementation team, and I've been with PCC for about 7 years now. I'm very grateful to be here and more importantly work with Sarah as we typically co-present and we really co-implement a number of these implementations. You will get things started today with getting things, what you can do most get out of CHADIS. We're going to go a number of different things that we want to talk about. But before we get into that, I'll pass it on to Sarah for introduction, and we'll also introduce Hannah from CHADIS as well.
Yeah, I'm Sarah Bunning. I've been at PCC for 20-something years in a variety of roles, and currently working on the Care for Patients team with Sasha, working with folks implementing CHADIS who are live with CHADIS and supporting a variety of other products, PCC products.
And here with us, we also have folks from CHADIS. So Hannah, if you want to go ahead and just introduce yourself.
Hi, everyone. My name is Hannah. I'm the account manager on the CHADIS side. So I support on the CHADIS side for implementation and also ongoing support. Probably met a lot of you over Zoom, but it's nice to see everyone in person. And I'm excited to hear the presentation. And if you have any further questions about CHADIS, you can definitely come find me at the booth or just at the sessions and talk to me.
Excellent, great, thank you, Hannah. And we'll get this presentation going. It's going to be very generic, very low-key. We'll talk about everything from getting your EHR configured, getting things done with CHADIS, and what you can do in terms of getting ready for CHADIS integration if you're one of those clients who is in this room, potentially thinking of going live with CHADIS. And also for those of you who are already using CHADIS. Again, a lot of stuff that Sarah and I will talk about today you may be familiar with. However, there are a number of different things that could get missed, could be misconfigured, maybe need some different adjustments. And so for that, we prepared this particular presentation where we'll have some real-time troubleshooting, some reporting, and as I mentioned earlier, we talk about a number of different places where you should pay attention to once you get into into the part where you're getting things configured and setting it up to go live. Again, providing...
Oh, I'm so sorry, Sasha.
It's okay.
Trigger finger, sorry.
And one of the things that I also want to mention is also getting your attendees benefits of integration. What are some of those benefits that you would have from this integration? Again, that's for folks in here who are thinking of going live with CHADIS. Okay.
And Sarah lost her mic. And back on track. Okay. One of the first things that we're going, well, not one of the first things, the first thing that we're going to talk about with CHADIS is configuration. So there's a good deal of configuration involved that is what makes the integration work. There's configuration on the PCC side. There's some with CHADIS. So practices who are looking to start using the CHADIS-PCC integration will work with PCC on some of the configuration on the PCC side, as well as working with CHADIS on some of the configuration on that side. Once those things are all done, that's when we work with your practice train and so on and go forward. The first configuration item we're going to talk about is visit reasons. So your visit reasons, PCC visit reasons. Everyone here had started somewhere with some visit reasons probably already populated on your system. We start out with some examples commonly used, well visit reasons, et cetera, some SICs and so on. And many practices just use what we give them, and other practices will make some modifications or delete some of them, make some other more specific visit reasons. Obviously, wells are sort of a staple. Everybody's got all your different age wells, and we have some others like behavioral and such. So the different reasons that you have, you may decide based on what questionnaires you want respondents or the patient to complete based on that visit. You may find that you need to make some more specific visit reasons. As an example, if you have if you have well visit reasons, and you do want to utilize some of the CHADIS questionnaire functionality of like an initial patient questionnaire, a family medical history to gather those items, you might want to make visit reasons that are specific for new patients. So you can have your regular well visits, but you could also have a new patient well visit reason. In that case, you would then be able to include not only the questionnaires that you traditionally would use for your well visits, but also any of those new patient paperwork types of questionnaires that you might want to add. The other one is like behavioral. So I've seen some practices have anxiety, depression, usually split out from ADHD, some other specifics. But sometimes some of those things can be lumped together. I have seen a lot of have seen a lot of visit reasons that are depression/anxiety. You may have different questionnaires you want your patient or parent to fill out for those types of visits. So you may need to break out your anxiety and your depression to be separate visit reasons if you want to be able to control which questionnaires they receive. The second piece is CHADIS visit types. So that's different. Some of you may have, when you're in your visit reason editor in PCC, you may see visit types. PCC has visit types where you can sort of categorize all your wells together, all your sicks together, and so on. What I'm referring to here are the CHADIS visit types. So the CHADIS visit types are something that you'll work with CHADIS to identify. They're basically categories for these different types of visits that you want to configure questionnaires. So you might have a visit type that is new patient well visit and a visit type that is just well visit. And then you might have your specific ADHDs, other specific ones like that. You work with CHADIS to get those visit types, and that's one of the first things that you're doing is sort of identifying those different categories or groups. But even if you, as you're working in your PCC configuration, if you determine you want some different ones, or at any point, if you want to change that, you just reach out to CHADIS and they can create a different type. And then the last piece of visit reasons is, are they mapped appropriately? So we're talking about PCC visit reasons, and we're talking about CHADIS visit types. These words are hard to keep in track, I'm sorry. You need to map them. And so I know that there are people in this room who are already using CHADIS, who have gone through and done some of this configuration. And then there's those who, maybe you're familiar with the visit reason tool, you've seen it, but you're not familiar with CHADIS. And some of you probably haven't been in there at all. We need to map those visit reasons. So when I'm talking about the anxiety visit reason in PCC, that's going to be mapped to a specific CHADIS visit type, and that visit type could be anxiety or whatever you call it. So all three things need to happen for visit reasons to prepare. I guess that's it.
Sweet. And just when you think you're done, well, you're not. This is just getting started. The other part of the CHADIS configuration that, again, for those of you guys who are potentially new clients of CHADIS, there's a lot of linking and there's a lot of mapping, right? And so both CHADIS and PCC constantly have to be in sync in order for questionnaires to get assigned, for the results to be returned back to PCC, and more importantly, returned and assigned to appropriate screening orders. Right, and so for those of you who are familiar with screening orders, you can actually create those, you can make adjustments, you can rename them, and so forth. In addition to that, you can also assign appropriate CPT codes so that when those results do come in back into the EHR, that you do have appropriate codes linked to those. You have to spend a good amount of time revisiting your screening orders, because a lot of times when you are getting ready to go with CHADIS, or even if you are using CHADIS, as we mentioned, a lot of times you end up adding a new survey in CHADIS. That particular survey that you're adding, or that questionnaire, does need to have a place to be returned back to PCC EHR, and a way to get that accomplished is by creating a new screening order if one doesn't already exist. So oftentimes what we see at PCC clients would say, hey, how come this survey or this results isn't mapping, or there's no billing code? That's because a PCC EHR will still get results returned to EHR even if there's no screening order. However, we'll open up a screening order for you. We'll name it something that you may not like, and in addition to that, it will be missing that CPT code. So you have one side of having it convenient, but the downfall of that is that the CPT code will be missing. So I always talk about this through the implementation process. There's a number of different meetings that we do with CHADIS and the client. It takes a whole team to get this implemented. And so we always talk about how important it is to create your screening orders ahead of time, link those appropriately, and more importantly, get your billing codes assigned. And again, so having those questionnaires linked to PCC, EHR is done, vice versa. So you have to go in both places.
All right. Another piece of the configuration, as I mentioned, is working with CHADIS as well, or it's on the CHADIS side. Configuring or selecting and configuring those questionnaires. So any of you who are familiar with CHADIS know they have a lot. Hannah could probably say the number, and I can't remember it.
Probably over 1,000.
In the 1,000, yes. So over 1,000 different questionnaires to choose from. That's a lot if you were to go there by yourself and try to figure it all out. Fortunately, Hannah is super helpful and can help the practice identify the appropriate questionnaires, the ones that they prefer, et cetera. So you're going to be choosing the different questionnaires. Each questionnaire is very configurable. So there's the patient age ranges. So when you assign a questionnaire, sorry, let me think. Based on visit reason, I was talking about visit reasons earlier, and that can, visit reasons obviously are related to what gets the questionnaire assigned. Specifically, in addition to the visit reason, we also want to take into account the age of the patient, because it could be a well visit, and that would qualify, let's say, for an ASQ. But we need to get the appropriate ASQ, so we have to have the patient age ranges, the minimum age that we want, so the earliest we would want a patient to get that questionnaire, and the latest that we would want them to get a questionnaire. So you have a lot of configuration options in there. Relationship to patient per questionnaire. So we're going to be talking a little bit more about relationships in a couple other contexts in a little bit. But the relationship to patient questionnaire is where you can identify in CHADIS who you want to be receiving that questionnaire. Do you want mother to receive that questionnaire? Is it in Edinburgh? That's not appropriate for dad, so yeah, we would want that to be set to mother. Do we have a teen with their own portal account? Relationship, we would want to set that relationship to self, because we only want the questionnaires assigned to the patient when they are specifically appropriate for that patient. Minimum days between assignments, so perhaps you have a questionnaire that you like to have filled out once a year, or maybe no more frequently than every 3 months. You can also set that on there so that regardless of if the patient ends up with another qualifying CHADIS appointment and they're within that age range, you can still make sure that they're not receiving this questionnaire that you only want once a year if they were just in your office 3 months ago, as an example. And then the teen-based questionnaires, I realized afterwards we probably should have flipped those. Under relationship to patient per questionnaire, teen-based questionnaires are pretty relevant there. So as I was mentioning, you can set a relationship to self. You can assign questionnaires to the teen. I say teen, adolescent, most times it's somewhere between 13 and 21. I'll call them teen. But you may want them to specifically get their own questionnaire. Maybe you want mom or dad to fill out a PHQ-9, but you also want the patient themselves to fill out a PHQ-9. You would, in your CHADIS visit type, have 2 PHQ-9s. One would be assigned to self, and one would be assigned to primary caregiver. So talking about the relationships in CHADIS, you have any primary caregiver, and that usually scoops up things like the common ones, mother and father and guardian and so on. But again, I want to stress at the end the importance of setting those patient ones to self so that you are gathering the information from the patient as well as the parent. All right. So, oh yeah, that was my segue that I just lost. Okay, so even after you do all that configuration, sometimes something isn't quite right. And why weren't CHADIS questionnaires assigned is the #1 question that our team gets from practices when something isn't right.
And we didn't need a report for that one, so.
We did not need a report for that one, that's right. It is the #1 question asked, and there are some things that we do first to try to identify the issue. And there are even things that you folks can look out for if you're using CHADIS, even before reaching out to PCC potentially.
Yeah, so I think I spent about 3 hours prior to the session today or this morning talking about portals. And again, in upcoming slides too, we'll talk more about portals and what we can do to help you guys out, get the adoption rate increased. But the long story short is that if there is no portal for a patient prior to scheduling that visit, there will be no questionnaires assigned. And we're all aware of how difficult that can be in getting portal users created for a variety of reasons. But if there is no portal, there will be no questionnaires. And so a lot of times we would get, questions or calls coming in through PCC. Sarah mentioned that we have to troubleshoot and that we have to look into. And then we will identify that, for example, patient did not have a portal account assigned before the visit was created. Again, one of the things to mention in CHADIS, we send patient data to CHADIS 7 days prior to the visit. And so if that portal account isn't created before that 7-day window is when we send the patient age to CHADIS, the train kind of left the station already, right? So you could edit, 6 days or 5 days prior, but it's already too late. The questionnaires would have been already assigned. And so, mom is coming into the visit, to the appointment, and has no clue that they needed to fill out the questionnaires. So again, you will hear us talk about upcoming slides, but portal, it is all based off portal.
Right.
And I think we have a question.
Quick question on that. It's not even assigned in CHADIS? Like if you go to the CHADIS website, is it assigned or no?
Yeah, that's a great question. So if it wouldn't be assigned, because if there is no portal information on that patient, we don't send portal information to CHADIS. Yeah.
Yep, go ahead.
Is there a good workaround for when they do show up in the office then? For how you then, it wasn't assigned, we give them a portal account, but now you're still stuck with that visit. Is there some sort of fast workaround for that?
Having that portal created after the fact, unless you schedule a new visit, it will not, retroactively trigger the questionnaires to get assigned. And so one thing that you can do is, again, you can manually assign questionnaires through CHADIS for that and so forth. But doing that, adding a portal after the fact will not, unfortunately, will not trigger those questionnaires to get picked up again.
And I will mention also that there is a tool within CHADIS. It's a login switch. I am not as familiar with this. Hannah, of course, is. Anyone at the CHADIS booth can talk to you more about that. But yes, there is a way if a patient shows up for their appointment, they haven't filled it out or they don't have that account, that you can hand them an iPad, as an example, if you have it, and have them fill it out right then and there. I saw another hand, but I don't anymore. Dr. Schwartz? If mom still has a portal account, yes, she can. Mom can still have a portal account even if she can't access his records. I'm sorry?
And the other thing is that we all notice that we use the work around using an iPad or something. I know this has been a good call. We have to relog in.
I think this is something that Hannah might be able to speak to, Dr. Schwartz, about the relogging thing.
Yeah, that's actually an incorrect workflow on CHADIS, so there is a way to just switch the login where they complete all of them at once before they get logged out. There is a way where it logs them out each time, so sometimes people are using the wrong way, so I can show you guys how to do that.
Lori, go ahead. Yeah, I mean, that's a great question. I think I talked to folks from Westside Pediatrics earlier about that, and then we come to the conclusion there'll be a number of practices here who will have that same problem. Yeah, I mean, it will have to find a strategic solution to get those folks signed up for a portal. And so that will be a number of different reporting that we can do, broadcast messaging, notify, and so forth. And I don't have a great explanation or great answer for that, because every office does it differently. And so it'll just be, it will have to be.
Is there a way that parents can share the status questionnaires like forward them to the 13 or 14-year-old? I mean, we have a lot of parents who their 13 but they don't want them 13.
Right. So one of the ways that they can do, as Sarah mentioned it earlier, is to have those surveys and questionnaires set up to where you have a self, and then you have also other primary caregiver. And so if the patient is a teen who does not have a portal, then mom or dad could essentially get those questionnaires and hand the phone or tablet or whatever for the patient to complete those that way. However, the issue with that is that when those questionnaires do come in, when the results are in the EHR, they're actually listed as a parent or as a respondent who filled out those questionnaires. Correct.
Yes. So that's why it's not a great option.
Yep.
Can I comment on that? So for our practice, what we do is that we just don't
Yeah, would have to be on
specific depression or drug and alcohol questions on CHADIS. We have the nurse, when she's doing the intake, ask the patient that, because we try to figure out workarounds with that. So we can just, because actually the parents were answering, like, do you use drug or alcohol? And the parents were, yes, I agree. Because they were thinking it's a question for them.
Oh, no.
Drink 5 beers a day, and I'm like, oh, that's my daughter. So we just figured we're gonna, we just took those and make sure those questions are asking what we bring up. We're doing that as well. Yeah. Still for the kids who want to, maybe ask, social determinant health, but that might be important. I mean, all those questions, questions that CHADIS is great questionnaires for, but the kids don't have that privacy.
Right.
There's got to be something within CHADIS done so that we can offer these kids the privacy they, legally deserve, right? And but without having this weird workaround. Because, again, under 18, the parents have to prove that the kid has a portal.
Right. Let's take one more question, and then we're going to have time at the end for questions as well. So go ahead.
So a couple of things. You said as long as they're invited, the kids can get it. We haven't started this, but I have read that people on the community are using, and in the past with another software we use where you hand them the iPad, it's really not difficult to masquerade them, hand it to them, take it back. So we're going to try that when we get home. I don't see why that wouldn't work because we do have a lot of paper and scanning. But the other thing that we do is we have a fake appointment type. We need CHADIS forms for something that didn't go out in the right time or the portal wasn't accepted in the right time. So that's kind of inelegant, but that's how we get forms out that we need to come back prior to the time of visit if the time was right.
I mean, the nice thing about doing it through CHADIS is they can do it at home before.
Right.
And
Right.
using that iPad, depending on how many questionnaires you have reading questionnaires.
Yeah.
You could, but then you're waiting when the nurse asks them, right?
Yeah. Well, yeah. So
And it scores them, so you don't have to add up that Vanderbilt or whatever.
That's true.
PHP9.
Well, and this is not in response to what Dr. Smith brought up about how do we handle these kiddos who don't have a portal account and maybe their parents don't want them to. The fact that parents don't want them to and so on, I think that's a really good discussion for practices to have here at the UC, on PCC Talk, share ideas. How do you promote it? How do you help parents become comfortable with the idea of their teen having a portal account? It's not only important because of CHADIS, it's also important because that teen now has a direct connection to communicate with the practice. Maybe they want to ask a question. Maybe they have things that they don't want their parents to know. It's really, really important for them, for those teens to have that private communication channel with the practice, if possible. I know I've heard a lot from practices about how difficult it can be, especially, it seems to be a little bit regional, I find, for some parents to be okay with it. It feels out of their control. But I think the AAP even has verbiage on that, on what to say. Yeah, Dr. Diazio.
Oh. Very
You're not Dr. Diazio. How did I make that mistake? I saw him, and he didn't come in. Sorry, go ahead.
Like an application, like an app that kids can add to their phone. I mean, I know other EHRs do a similar thing, and then once 13 happens, like parents no longer have access to that account, and so questionnaires in the application for children. I mean, most kids by 13, a lot of them have a smartphone,
Right.
and so then their questionnaires they attach to their visit. Really, only they would have that login.
Well, the portal access absolutely can be an app. You can use it on a computer, you can use it on a tablet or smartphone. So if the patient has a portal account, absolutely. It's not an app that you get from the App Store. Basically, you just save it as an app onto your phone. But they would have that access right from their phone. So again, it's really, I think it's a really interesting topic about getting onboarding.
Is there any kind of like handouts or things that you're creating that we could give to families to kind of show them how to sign up their child for a portal come age 13? It could then be shared with the family at that visit at the front desk so that they could.
I like that. We have some documentation about it, but not direct in that way. So I really like that idea, actually. That might be very, very
so.
helpful. We are recording this.
Talk about creating a factor test too. I do send out newsletters frequently, and there's always a thing about, check for this and that. I mean, the problem is if the kids have the account instead, what are the chances they're going to see and respond to either a text from X, Y, pediatrics or an email and go in and do it their own. One thing about the parents getting is that when the kids, if they read part of the
Sure.
for you, at least they hand it to the kids.
Yeah, well, that's true.
So many levels are.
There are, yeah. There's a lot to it. There's a lot of pieces.
Yeah, but portal is certainly
Yeah,
a big topic
the portal's
here.
a big one. So, yeah, so all this was, why were questionnaires not assigned? Could it be the portal, or, what's next? Oh, I hit it too fast. Could it be no relationship? So I did talk about relationships earlier. There are relationships, there's a relationship piece on the PCC side, and there's also a relationship piece on the CHADIS side. This is PCC portal administration. Many of you probably recognize it. Highlighted in that area is the drop-down where it says select a relationship. So when you're creating a portal account, so when you go to portal administration from the tools menu, or if you're in a patient's chart and you edit it and manage portal users or add a portal user, and once you've created them and added a patient, this is what you'll see. And each patient that's listed will have that drop-down for a relationship. And this is the portal user's relationship to the patient. So again, self, I'm just going to keep driving it home because it's important. For patients who have their own portal account, it's really important that they get self there, or that they can put self there. If they don't have that relationship there, they're not going to get the appropriate questionnaire. Okay? For parents, custodians, guardians, grandparents, whatever they might be, if they're ones that you want to be filling out questionnaires for the patient, you need to select a relationship. It's important to select a relationship, as I mentioned earlier as an example, like mother. If it's an Edinburgh that you're sending out regularly, that you have queued up for auto assignment, you want to make sure that mom's relationship is mother. That said, if a relationship is missing from this field, once this information gets sent over to CHADIS, CHADIS will, is sort of a fail-safe. They'll interpret that as primary caregiver. So it will still assign those ASQs, those typical questionnaires that are going out that are generally assigned to parents or guardians. They'll still get it, but again, really important for teens, really important for mom. Okay? What else could it be, Sasha?
I don't know. I think a couple more things. Could it be minimum or maximum age range? This slideshow here, maybe this is actually a perfect setup in CHADIS because all the different minimum to maximum age ranges like set up in perfectly. However, a number of times we have come to a conclusion that when we looked at certain issues in certain cases, that a lot of times the minimum versus maximum age isn't aligned into the next upcoming questionnaire. And so this is also very important because, as I mentioned earlier, we do send patient data to CHADIS 7 days prior to that visit, right? And so it's very important to take that into calculation at the specific age range, because CHADIS doesn't care about what we do to get a system configured in terms of orders and visit reasons. Once CHADIS gets information from us, all they care about is patient's age, right? And the age at the time that when we send that information to CHADIS, which is 7 days. And a number of times we've had issues with questionnaires not getting assigned, and we realized it was like maybe a 2 or 3 day window that was missed either before or after. And so I always emphasize this highly. When you are going through setup, Hannah does this a ton too with clients. Please, maybe even if you're a live client now with CHADIS, you may want to go back and just making sure that all this stuff is accurately configured and set up. And as a new potential CHADIS client, this is something that Hannah and I will talk to you a lot in terms of getting this part here configured correctly. Again, this particular image here is just how it really should be, but probably should have done a different one.
Yeah.
But we want you to see
Do we
both
show
sides.
the problem or do we show it done well? What I like to point out here is that, like, the ASQs are a great example because we see the different ages. I'm like pointing this, but I'm not actually using a laser. Okay. We can see the different ages of the ASQ that are here, and how under the minimum and maximum age ranges, you can see this one goes from 5 months to 7.5 months. And then the next one starts at 7.5, and it continues that way without a gap. A number of times we have gotten the question, why wasn't a questionnaire assigned? And after going through a number of parts of it, we could come here and look, and sometimes I've found a little gap, like maybe it says to 7 months, and then the next one starts at 7.5. Sometimes that's appropriate depending on the questionnaire, depending on what you're trying to do, but most of the time, that means, especially in the case of the ASQs, that means you could miss some kiddos in there. Depending, I mean, oftentimes they'll come in around their birthday or at, once they turn an age, but sometimes they're coming in 4 months later for some reason. So it's important to have those really tight, not to miss anybody. Question?
So if you have if the kid is exactly 13 months old, are they going to they're just going to get the one assigned to the visit type for the visit reason? They're not getting both.
No, they would not get both. It's all how you have it here. Oh, that's a good point. It ends at 13 months, correct? And then,
Sorry, Sarah, to interrupt. Folks on the stream can't hear the questions. They were asking if it's possible to restate the questions.
absolutely.
Oh.
So that the folks who were live streaming can actually hear.
Absolutely. I meant to do that, totally forgot. Yes, so the apologies, folks that are virtual right now. The question was, looking at this slide at the ASQ for the 12-month and the 14-month, the maximum age for the 12-month is 13, and the minimum age for the 14-month is 13. And we had the question of, if a patient is exactly 13 months, would they get both? And the answer is no, but I've never never been asked that question, so that's a great one. How is that determined?
So maximum age is exclusive, meaning that they'll get it up until. So in that situation, at exactly 13 months, they would only get the 14-month one. So maximum age is exclusive, minimum age is inclusive. So
Great.
at exactly 13 months, they would no longer get that 12-month one if it's the max age, and then they'll get the next one at the minimum age.
That's what I figured, and I'm glad that Hannah was here to articulate it better. All right, so
But there might be more.
age ranges. So could it be, if it wasn't any of the things that we already went over, could it be cancel versus reschedule? This is a funny slide. Again, it's not showing us anything terribly helpful here, but I'll tell you what I mean. When you have a qualifying CHADIS appointment in PCC and you cancel that appointment, PCC sends that information over to CHADIS, and then CHADIS will cancel those questionnaires. Now, there are some exceptions. Well, I don't know if I should call it an exception. If a patient, so there are some dependencies, I guess. It can vary based on when that cancellation happens. So if the respondents have already been assigned those questionnaires, they can get canceled. But if they've already completed them and submitted them to the practice, they do not get canceled. Those results will still be in PCC, even though that encounter has been canceled. And it will create an additional entry in your visit history index with just those CHADIS results. If it was canceled and there's nothing else there, you can't really cancel that appointment because there's clinical data in it. Okay, so it does create that additional entry. Rescheduling a rescheduling a visit, however, will take anything associated with that visit already, which could be the CHADIS results or the orders for CHADIS, and it will move them to the new appointment that you reschedule. So a big difference between canceling and rescheduling. Dr. Smith? No, it's okay. No, that's fine.
Is there any notification to the provider? Like, let's say it's a rescheduled again in like 2 weeks. My concern is if there's an answer to the question, like let's say suicidal answer, right? And then there's no notification to the provider to know that the CHADIS questions have been answered. And then 2 weeks later you find that, like obviously that puts us at some risk. So is there any notification in there that would say, here's some CHADIS appointments or whatever it may be?
Yeah, there's a configuration option that addresses just that. So Sasha talked a few minutes, yes? Repeat the question.
Oh, yeah, we have to get used to this.
Yeah, boy. Dr. Smith's question was, is there any type of notification to the provider if an appointment has been canceled, but there are CHADIS results, and maybe that appointment got rescheduled for weeks later, but those results are already in PCC? The answer to that is yes, there's a configuration option. Sasha talked about configuring orders, your screening orders for these CHADIS questionnaires. When you link the CHADIS questionnaires to your screening orders, and you see them there is a checkbox that you can check. And darn it, I can't remember exactly what it says.
Signature required.
Thank you. No, is it just signature required? Yeah, it's signature required. I should know that. So if you check that box, and that is per questionnaire also, okay? If you check that box, when the results come in, when the patient or parent submits those results, those will also go right to the provider's signing queue. Even if the appointment got rescheduled for 3 weeks later, if those results are in, they will go to the provider's signing queue. So the provider can then see those results ahead of the visit. If it's something like, if it's a safety, suicide risk, then the provider can act on that and reach out. Yes. So I would recommend with those, since it is per questionnaire, just checking off a few, like PHQ-9, the specific ones that you think you would want to see. I understand it may still generate a number of them.
So it won't be able to filter out the ones, any flags to be.
No, it does not currently. So you're right, you're going to get your happy path, good answers, and you're going to get the concerning ones.
Like the ones that are canceled that are floating out there. Like the ones that are coming in, those are in the visit. Like you're going to address them as you go along. But it's the ones that are canceled that aren't canceled. The ones that are created and then like moved for some reason. You don't see them. Is that a focus on your safety?
Yeah, go ahead, Dr. Toff.
Can you comment, please, on when a test is ordered? For example, is a CHADIS ordered before the patient comes in, or you come in and it's already happened automatically, but now if you don't order it, it's not part of the record?
Sure. So the auto assignments.
Question.
Question, I am not good at this.
Neither am I.
The question, now I've lost the question. Yes, so the question is, when do these things happen? Are they ordered during the visit? Are they ordered before the visit? How does that happen? Sasha mentioned at one point that questionnaires get assigned 7 days prior to a qualifying CHADIS appointment. So 7 days ahead of that appointment, the CHADIS and PCC exchange information. They look at the information. They say, okay, we're going to assign those now to the respondents. So those auto-assigned go out 7 days ahead. If you're making an appointment for tomorrow, as an example, then it would go out at that time. During a visit, you may decide, I want to do another questionnaire, a different questionnaire. Your practice can go to the CHADIS site and manually assign one to them, and those will come back. They don't come directly into the encounter. They come in through the messaging queue, but then you assign it to the encounter. It's just slightly different workflow.
Yeah, and then unlike in the EHR, ordering, when questionnaires do get assigned, and once those, they get auto-assigned. And that's the only thing in the EHR when it comes to auto-ordering is that we will actually place those screening orders for you automatically based on the configuration we mentioned earlier in what you have in your screening orders. So.
Did you have a question as well?
Yeah, so for an appointment that's been canceled, they already completed the questionnaires, say they call back later in the day, make the appointment again. Can you pull those results into the new visit that they're coming in for?
Currently,
Repeat the question.
it's an excellent question. Today, you actually would have to copy-paste from the original order and put it into the order, or I should say, you could go to CHADIS and download the results from there, print to the EHR, and then tuck it into the new encounter. I forgot where I was going. Can you finish that? Sorry.
Yeah,
No.
it's, that is going to change. I think that's probably where you're going with that, because we do have some
That is
change.
what I was going to say.
We have some changes coming up that will, in the later slides, because obviously right now that's a lot of manual work, and we have identified that a lot of clients struggle with that. And in the upcoming release, I believe 9.5, clients will be able to have the ability to choose where they want to move that
the
particular
encounter.
result to.
Nice and easy tool, so you can do it.
I think it's kind of tagged to yours, and then I want to go back to your question. I thought I understood that if, when you're in the front desk and rescheduling an appointment, and the AHQ forms or whatever CHADIS forms were completed, if they use the reschedule function, anything that was attached to that original visit that was canceled or no-show would now move to your new appointment. So does that answer what she was asking?
No, I was asking, sorry, if they
No, go ahead.
cancel the appointment and it just goes in and sits there,
Right.
and then maybe they call back the next day and make the new appointment, it just sits there? or
So,
is it
right, so
totally
the
different?
so in the cancel versus reschedule, if you cancel, then that is generally canceling those questionnaires being assigned. If they already have results, as I mentioned, those will still come in to the original encounter that was canceled and will be there in the visit history index of the patient's chart.
Very often, if a patient cancels and they're not able to reschedule at the moment and they call back in the future, I will go back in and just use the reschedule function. I'll pick that one up again, kind of reactivate it, and then move along. That to me was the correct workflow
Yeah.
for this. Then the second question, back to what we were talking about, the flag. If there isn't an automated way to flag those patients who completed it, would that
We're talking about reporting. This is probably
You're on.
my favorite one. And so we covered a little bit with configuration issues with that and what we can see. Then we talked about a little bit about what kind of issues do we typically see. One of the things that Sarah and I also wanted to hopefully pass on the message in what can you do in terms of what kind of reports can you use in the EHR to also identify, again, we talked about portal. And so we do have a number of different reports that you can run that you may find helpful in proactive outreach to your patients and to your families to get them to sign up with the portal, because we do, for obvious reasons, know that portal is a big issue. And again, no portal, no questionnaires, which probably come up in the next slide, and you'll probably see that again. And again, it's a very sort of repeating thing, but it is a number one item that we need to have for this integration. And so what we are going to talk about in the next few slides is that what kind of report can a practice utilize to hopefully identify those appointments. And one of the things that we can run is just a basic report. You can just get an idea how well are you doing in your portal adoption. That's just one, like who has it, who doesn't. And then you can get a little bit more specific. You can identify upcoming appointments without a linked portal account. And then, so you can run those 2-3 weeks in advance where you can identify who some of those patients are coming for specifically for CHADIS qualified visits that you can proactively reach out to them and have them to sign up for a portal, whether that be a broadcast message, a personal phone call, whatever method that the practice is using. And lastly, I think I spent a little bit of time just talking about this today, identifying those teens without their own portal account. Well, first we got to get them to sign up for a portal in the first place, and then we can talk about, who they are. And so this is also probably a second question that comes up for Sarah and I, and typically in our team. What is the best way? Again, that question I haven't been able to solve yet.
Yeah. We all know teens are challenging. It's no different here.
However, we can identify who they are. We can do some proactive work that we're going to show you in the next few slides. One thing that you will notice, we're very aggressive with all the circling and all the squares are very in red. It's very aggressive, but that's for a reason. So we'll talk about that more in detail.
For those of you who are familiar with the report library, some of this will look familiar. Maybe it's not reports you've run, but we wanted to highlight them with the big old red to help people look at the criteria that we're using to run these different reports. You can also see up on the left, it tells you where you can find that report. But I'll say before we go into the reports that, this is great. If you remember, awesome. If you need any help setting up the right reports for these purposes, you can reach out to your CA. Your CA should be able to help you with reports, and if there's anything specific to CHADIS that they need help with, then they reach out to our team. But yes, so this, as Sasha I think said, this first report is a pretty basic portal report. This is really just checking out your adoption rate. How many people do we have that have portal users set up? How many patients have a linked portal account, whether it's themselves or whether it's a parent, as an example. So this is a good report to know. It's really good to be aware of your portal adoption because it's obviously very important for CHADIS, among other reasons. So this is a good place to start. And then there's other reports.
All right, our next report is portal users by appointment date. And that's, this is the one that I use a lot, actually, talking through different implementations and working with clients on a day-to-day basis. One of the reasons as to why we wanted to show you guys this report is that, again, you can use a specific date range, right? So you only care about a specific set of patients coming in to your office within a specific date range. And so right here, you'll be able to see that blank, this is what we don't want to have, right? So we want to have linked portal users right here. So this is an easy way to identify, what you have going on in the next, number of weeks. And more importantly, you can export this, you can send it, you can use it as a broadcast messaging, you can have that consistent message that we talked about that you can send out to these folks who are on the schedule, for the future. And hopefully you'll have a good return in terms of outreach back to the practice for these folks to sign up.
And then lastly for the report, this is my favorite. It's probably Sasha's favorite too. It's a good one, all right? This report is called Portal Users by Relationship, okay? Portal Users by Relationship. We can see in the first red rectangle, I guess, the portal user status. In this report, we want to see patients, and it's hard to talk about it unless I mention that this is an appointment-based report. So the one that Sasha was just going over is also by your schedule. This one is based on your schedule as well. So you can identify patients with upcoming appointments, and this one specifically, so back to with a portal user and without a portal user. And I'll explain why in a moment. Patient age, this is where we can identify those teens. So this is a great report to find any teens. Do they have their own portal account? Do they have, do the teens, but also any other portal accounts that are associated with these patients coming in, do they, sorry.
If they have a relationship status.
Thank you.
Yep.
Do they have a relationship status? Goodness. Because we've talked about the importance of the relationship. So this report will help you to identify those patients With a portal account, it'll show whether, if let's say it's a 13-year-old, okay, or a 15 or 18, and they have, you can see on the schedule, because it will sort by schedule, that they have, there's linked to a parental portal account. Great. You would also see if they have their own portal account. So the presence of that, seeing their name there, you would see that they do. The lack of it, you would see, oh, they only have a parent portal, and you could identify the patient who needs one set up for themselves. But again, this can also really be used just to find those relationships. So if you said, I'm going to go in and make sure that we have all the appropriate relationships set up for all the portal accounts, this would be a great way to identify those that don't have a relationship. And you can, when you get the results of the report, you can sort the result. By default, it's sorted by those appointment times and dates, but you can sort it by those who have or do not have a portal account, just to address those.
And one thing too, the reason why we really wanted to show you this report is because at the end, it is specific to CHADIS specific visits. So you're not worrying about anything else but just CHADIS specific encounters. All right, we have about a few minutes left, I believe, maybe less than 10. But
And we talk too much.
we wanted to, hopefully get you guys some excited on this particular slide here. As you can see, there are 3 different things that we listed on here for both 9.4 and also 9.5 release. Again, starting off with the number 1 is to reduce the need for practices to manually add patients to CHADIS. This is some improvements that we have done here at PCC in order how we sync current patients over to CHADIS. This time, in the moment, we sync patients over to CHADIS based on a qualifying CHADIS visit. And so it takes a little bit of longer time to get everyone synced over to CHADIS. We're making that change where as soon as you register a patient has a portal and so forth, qualifying patient name and date of birth and so forth, we'll get that patient synced over to CHADIS. For those of you who are using Pocket PCC, you'll be able to see those questionnaire results on your phone, on your tablet, and so that is also coming up in 9.4. And one of my favorites, which we just talked about moments ago, ability to move CHADIS results to a different encounter. And again, that is coming in 9.5. Some of you may ask when that is. I don't know that answer, but I know it's sometime in December, before the end of the year.
Sasha, just a second. Jim?
Oh, yeah.
Yeah, just one quick point about that third item. It's possible that will be slated for 9.5. It's possible it comes in a little bit later. As is always the case with our user stories, we've got multiple horses in the race, and it's a question of which one's gonna, or which couple of them will cross the finish line first. So it's possible, but more to come. As we have information coming out about those releases. But it's definitely we've worked on some designs, some plans for it, and so it's definitely in play.
That's right.
And because I said it's 9.5, it should better be 9.5. Not just
We have it documented. We can't go back.
All right.
All right. So we did go a little bit long, and we want to make sure to have questions, time for questions. So we don't have a lot. I will say that you can always find Sasha or I at the UC. You can always reach out to us after. You can ask questions in the open lab. If you have questions that we're not able to answer here, we will take care of you. Just come and let one of us know. But the takeaways, I'm not going to read them to you. You folks can read that. We wanted to give you an overview or an idea of the configuration best practices and workflow, the reports that are out there. And those reports can help you whether you're getting ready to start using CHADIS or whether you're already using it. Those reports are good anytime. And understanding the benefits for like the auto assignment and how that can all flow for you. So,
I think we have about
any
5 minutes.
questions that folks have? Yes, Judy.
Judy, why don't you also take the mic here? So
We're going to put you on the spot, Judy. We need everybody to hear you.
So we recently just signed up, so we're not in, we've had our meeting with Hannah, but that's about it. I just have a question for anybody who's using it. What has been your experience with the patients actually filling out the questionnaires on the portal before they get there? We just have a really non-compliant population of patients, and I'm just thinking I'm going to be handing out these iPads like crazy when they come in because there's not going to be anything done. Oh, no, I said, nah, less than Stella? That would be pushing it.
Most things are Yeah, there's two groups. There's ones that don't have portal accounts, and I'm getting really testy about this, almost to the point where saying if you don't want a portal account, don't come here. I mean, it leaves out a few people who legitimately don't have phones, but I'm almost at that point. But so there's people who don't have an account, and then you're kind of stuck. And there's people who do account but didn't have the time in their busy lives to pay attention to stuff from one of the more important emails that you get. So for those, I just find it easier to, even if if I have to stand and reset them, it's quicker to stand there. Look, I'm going into EHR. I'm sending you a password reset. I usually ask what their telephone number is, so they get the password reset to their phone and not to their email. And do it now. Log on. It takes about 2 or 3 minutes. And the whole setting up I mean, I know we're doing something wrong with having to log in each time for four newsletters, for 4 screens, but I find it's quicker to make them do it on their phones. And there's other ways to send them the links too. I haven't really paid too much attention to that. But that way at least they're set up for the future too, and it just takes an extra couple of minutes.
Anyone else? Oh, I think
There's a question back there as well. Yeah.
Okay, go ahead, just because it's easier for folks.
I just want to add to the last question and say it's gotten a lot better for us over the last year. It really depends on your front staff. Even if they have not filled out the forms in advance, but they have a portal account, then we have the nurses generate a QR code, and then they do it right there in the rooms, and it's very simple, and it integrates with the visit, and so there's no issue. So I would say while originally it was probably 30% for us, it's probably close to 80%. And I really credit our front staff with every time, and we have had a big push with our docs to say, are you on the portal? Because every time they have a question, oh, you need that immunization record, you have to get it from the portal. You need a medication refill, it's on the portal. We are not really allowing people to not sign up for the portal, so that even if they don't use it, they have a portal account, and it makes the flow in the office much smoother.
That's really helpful, Dr. Craig. I like that. Anyone else have anything to add? You have,
If you're just going to do that, just for the folks who are virtual, it'll be easier for them to hear it.
So the question is directed to Hannah. Hi, it's Michelle from Westside Pediatrics. We've talked plenty. Is there, and I, forgive me for not knowing this, it may be there. Is there a report that I can run that will generate, or give me the numbers of how many CHADIS reports I've sent out, how many have been completed at 100%, and how many have not been completed? Because that may help us look at, what's valuable, what works, what doesn't work, because we don't survey our patients.
All right. A little bit.
Yeah, actually, so on the CHADIS side, we do have some reporting for things like that, where our IT team can set it up to email you daily or monthly or weekly or however often you want. And there are different parameters you can use, so you can see just how many were assigned versus submitted. There's actually a lot of nuances with that too that I would have to, make sure our IT team can run in terms of scoring, like how the scores came in. So earlier there was a question about filtering for high-risk results only. We actually may be able to send you an emailed report on the CHADIS side, and that would be something our IT team would set up. It's a secure, it's encrypted, so it does have patient data, but it's encrypted. So I can talk to practices individually about that. I've talked to a few about it, but there's a number of different reports we can do on the CHADIS side that just sends you an email.
great. Yeah. And we have one more question in the back that had been there for a while. Want me to run it? You need a break. Nobody wants to see Sarah run. Here.
Okay, sorry, no question. I was just going to tell you not to be discouraged because we do what she mentioned about encouraging the people to do the portal right there, have the people at the front desk, because it's not the best use of the doctor's time to have to, although they can do it, to make sure before the visit hits that they have the documents in place. And then the CHADIS button is just right inside there, single sign-on, no big deal. Touch the button, go through the form. Ages and stages may take a while, but our population had been using CHADIS before we came to PCC, so they were accustomed to it. They were looking for it. They were excited when it was cranked back up again and they could do it at home. So don't be discouraged from listening. This is a lot of work. It is, but it's a lot of work to get these forms one way or another.